Anterior cruciate ligament knee injury.
In the previous video, we spoke about common knee injuries. This video will focus on the anterior cruciate ligament, which is a major ligament that aids in stabilizing the knee joint. The ACL is the first structure to be damaged during the valgus force, followed by the medial collateral ligament and the medial meniscus. A sprain or tear is the most common type of ACL injury. The ACL is tested with multiple maneuvers that include the anterior drawer test, the pivot shift, and ligament test. When there is suspicion of injury to the anterior cruciate ligament, this test should be performed, including single leg stance test to evaluate the dynamic and functional postural control performance of patients with a lower extremity injury and assess muscle function deficiency.
Epidemiology.
There is no age or gender bias. However, it has been suggested that women are at increased risk of ACL injury secondary to a multitude of factors, such as weaker hamstring, valgus angulation of the knee, the stress on the ACL ligament increased when changing direction suddenly, and predisposing females to injury could be a result of estrogen's effects on ligament strength and flexibility.
Mechanism of injury.
An ACL sprain or tear is a common knee injury. Injury is usually a result of sudden changes in direction of movement during activities or sports play, such as stopping abruptly, jumping and landing abnormally, causing a direct injury to the lateral aspect of the knee, or slowing down while running.
Symptoms.
At the time of injury, most patients complain of hearing or feeling a sudden pop and their knees giving out from under them. There are other symptoms that include tenderness along the joint line, pain and swelling, decrease or loss of range of motion, and difficulty ambulating.
Clinical examination.
The clinical examination must cover the time of injury, the etiology of the injury, ambulatory condition, joint stability, mobility, strength, palpation, and evaluation of potential associated injuries.
Diagnosis.
ACL injury can be diagnosed clinically. However, imaging with magnetic resonance is frequently utilized to confirm the diagnosis. To diagnose ACL pathology, MRI is the primary modality.
Treatment. Tratamento.
RICE therapy is the basis of acute treatment, which include comprehensively rest, ice, compression of the affected knee, and elevation of the affected lower extremity. Patients are required to be non-weight bearing and can use crutches or a wheelchair as needed. ACL injuries can be treated either non-operatively or surgically, depending on their severity. If a patient has an anterior cruciate ligament injury, they should be referred to an orthopedic physician to discuss treatment options and an exercise program for rehabilitation. The patient's baseline level of physical activity, functional demands, age, occupation, and other associated injuries are among the factors that determine whether to undergo operative treatment. Those who have significant instability of the knee and or multiple knee structures injured are also candidates for surgical repair or reconstruction. Operative treatment is a typical procedure for tissue graft. The choices for graft include predominantly the hamstring semitendinosus, quadriceps, patellar tendon, autograft, or allograft.
Differential diagnosis.
Epiphyseal fracture of femur or tibia, medial collateral ligament injury, meniscal tear, osteochondral fracture, patella dislocation, posterior cruciate ligament injury, tibial eminence fracture.
Return to play.
While there is no standard return to play protocol, studies indicate that returning to play is safe when an athlete meets a specific set of clinical criteria. These include 1. Time from surgery 8 to 12 months or more. Second, absence of pain and effusion. 3. Knee range of motion comparable to the contralateral limb. 4. A negative Laumann or pivot shift test. 5. Successful performance of hop test at more than 85 to 90% the performance of the contralateral limb. 6. Jump and landing tasks such as the drop vertical jump without evidence of dynamic valgus.
Rehabilitation.
Strengthening, balance, proprioception, and mitigating the inflammatory response are achieved through protective bracing, electrical neuromuscular stimulation, and isometric, isotonic, and isokinetic exercise. Recent studies suggest that platelet-rich plasma (PRP) may reduce pain and improve range of motion and limb function, and it demonstrates evidence of repair with decreased synovitis on histologic examination compared to saline injection. I would like to express my gratefulness to all the guys who took part in this video. And thank you for taking the time to watch this video. Me gustaría expresar mi agradecimiento a todos los chicos que participaron en este video. Please do not forget to subscribe. Thank you very much.